Welcome to Confessions Beyond the Food. I'm your host, Nancy Ridlen. Let's dig in and get inspired. Hi guys, welcome back to Confessions Beyond the Food. I'm so excited to have you here today. I've got my friend Blair in the studio. Really pumped to have her here. We're going to start off with a little something different today, shake things up. I'm going to start off with a confession that I have to share with all of you, and something that not a lot of people know about me, and you would never know by looking at me. I have endometriosis, and I have had this disease forever. I mean, since I was like 15, it wasn't diagnosed till I was 31. And I've had 10 plus surgeries. In 2020, I almost died because of this. And it's been a real thing in my life. It's affected everything. It's affected me personally. It's affected me in my career. And it's incurable. And not many people know about it. I sure didn't know about it back then. But I'm really excited because there is a lot more awareness and there's a lot more research around this, and because nobody's ever had this in my family. And so I wanted to bring this up on this platform because it's Endometriosis Awareness Month in March. And so I wanted to share that with you. And one of the great things about my job is that I get to know my factories like really personally and get to know them as friends. And we end up sharing stories. And we had just signed on Better Earth, and Blair was sent down to Austin, and I was sent down there too to go ride along together for 2 days together in the car and go meet customers. And we just had the best time. And we're like, let's go drink margaritas and eat Mexican food. And we got to know each other and kind of share our stories. I'm just thrilled to have her here today. So I'm going to pass it over to you, my friend Blair, to tell a little bit about you.
Yes, I'm Blair Michal. I'm the circularity coordinator on the sustainability team at Better Earth. We're a sustainable packaging provider, and as Nancy said, work closely with W3 Sales. And I also have endometriosis. So I have endometriosis, PCOS, and infertility, like a lot of other women, 30 to 50% of endometriosis patients. Like Nancy said, I've struggled with this since, puberty, since I was 14 years old, so over 15 years. And it has affected every single facet of my life. Like Nancy said, personally, professionally, in my relationships, and I'm sure we'll dive into all that deeper. But like Nancy said, really passionate about spreading awareness around Endometriosis Month, especially during the month of March, and how our industry can help not only influence the environment, but also our health through sustainable packaging alternatives.
Yeah, I mean, thank you so much for sharing that, because I'm like, I don't know about you, Blair, but I'm like sweating, like telling this information. And I'm not a hot person. I'm a very cold person. It's cold today in Dallas. And so it's very vulnerable to share this kind of information with people. And it's very personal. I think in one of our podcasts before, Danielle mentioned, your work is part of your life. You can't compartmentalize that. And so, work is part of my life. And I'm so thankful to know Blair and to understand her story and how packaging, goes hand in hand with our health. Like I mentioned, I didn't have anyone in my family who had this disease, nobody. And then when I heard about some of the health, the dangers of microplastics and how much we consume, and how there's a correlation between that and women's health, I was like, this just got real personal.
Real quick.
Real quick. And Blair and her team, I mean, not only are they passionate about like sustainability and the environment, but really health. I mean, that was something that we can all relate to. And so, can talk to us a little bit about how plastics affect, women's health and in general, everyone's health?
Yeah, definitely. So, plastics are a huge contributor to our chemical exposure on a daily basis, right? There has been over 900 billion tons of plastics created since it was really commercialized in the 1950s. It's in almost everything. It's ubiquitous in our society. And with that comes thousands of chemicals throughout its life cycle from, beginning of life, that all the way to end of life. And so with that, we're exposed to different classes of chemicals, but the endocrine disrupting chemicals are really a huge concern for me, and women's health. I know we were talking about this earlier, Nancy, but I saw a study recently where phthalates, an endocrine disrupting chemical, otherwise, sometimes shortened to EDCs, there was a study that showed a direct correlation between phthalates and endometriosis. In fact, almost 150,000 cases of endometriosis in Europe were connected to phthalates. But at a broader level, plastics affect everyone, not just endometriosis patients. As I mentioned, there's been over 900 billion tons of plastics created, and less than 9% of that plastic has ever been recycled, which means that it ends up in our landfills, in our environment, in our food chain, and therefore in us. So one study showed that we're consuming, on average, a credit card's worth of microplastics a week. And there's many other studies out there that show that microplastics have been found in all, major organs, as well as in our blood, as well as in unborn fetuses and newborn babies. And that these plastics and other chemicals can accumulate in our body and be passed on from generation to generation. So we don't even know the true damage that's to be done. It's really inestimable. And we're really just beginning to see, the results in things like endometriosis, PCOS, infertility, and other health issues. And then at the same time as those rise in health crises, those rise in environmental crises. But I firmly believe that they go hand in hand and that the solutions do as well. And that, any work that we do to, help the planet, we're also helping people and vice versa.
That is just, I mean, those statistics, when I heard them, and you guys do such a great job on education, but a credit card's worth. That is a lot.
That is this much plastic a week. Oh, I should probably cover up that information. But that is this much plastic a week.
That's a lot, y'all. I mean, doesn't that scare? I mean, that is just such a scary statistic. I mean, that because it's not only like in, our packaging, but in our clothes and everything. And I mean, guys, like, I mean, even as a guy, I mean, I'm sure there's going to be studies coming out how, if it's in your
Oh, yeah.
lungs, I mean, affects you too out there, men.
Yes. We're
Right?
actually we've seen already, and this is, more related to chemicals, especially those endocrine disrupting ones we talked about earlier, but just in the last 50 years, not even 50 years, there's been a 50% decline in sperm. And men's hormone health issues are on the rise as well. So it affects everyone, not just women.
Yeah, and infertility, I know we're talking about endometriosis. I mean, a lot of people can have infertility for various reasons, but I also suffered from infertility. I had to go 3 rounds of in vitro, and again, I mean, I was in the hospital like all the time in the emergency room. I mean, I think they knew my name. They're like, "Go on back, Nancy." I don't know if you feel that way, Blair, but
Yes. Oh my gosh, yes.
and the thing is like too, is like nobody knows what to do with this. I don't
Yeah.
know because there's not a lot of research. I mean, the research is slowly coming out, right? And there's not a lot of medicine to cure what we have. And if you have it to the degree, and I haven't met someone that has it to the degree that I have it, like Blair does. And so, where pregnancy, a lot of women, when they get pregnant, it goes away, but, and then or they might have a hysterectomy and endometriosis goes away. Well, spoiler alert, it might not go away. And I'm here to say that because that's what's happened to me, and because it's microscopic and it's crazy. um you know I mean, and I mean, it's just crazy how little we know about this. And I'm gonna do another quick little confession. Like, my kids, I mean, they are I call them the sustainability police at my house. They're all about the 3 R's: reduce, recycle, and reuse. And I mean, they're really into it. And so, but I mean, even my husband has always been way more into sustainability and knew a lot about it. Like, we clean out our plastics and stuff like that. And then, but this hit me. And so I know I keep saying that, but I think it's so impactful, that there needs to be more awareness and about this, and making a direct impact, in your homes. So, Blair, how can what are some tips like that we can do as consumers, as people that, have the choice of sustainable packaging or not? Can you talk a little bit about that?
Yes, definitely. Yes, so we've already talked about, the implications of plastic on the health, on our health and the health of the environment. And so one of the things I love about compostable packaging is that it can address both of those at the same time. Like I said, through compostable packaging, we're able to reduce plastic production, plastic pollution, and just exposure to plastics to those everyday products, especially those food contact, items, and getting it out of our food chain and therefore our bodies. I also love that compostable packaging not only is made from, sustainable raw materials, but the compostable packaging industry goes a step further and requires third-party testing and certifications and standardized labeling to help consumers ensure that they're purchasing products that are, that don't have certain chemicals like PFAS, right? Or heavy metals and things like that. So being on the lookout for BPI or CMA certified compostable packaging is a great way for the food service industry to start making that switch to more sustainable alternatives and reducing our reliance on those petroleum-based plastics. But for the everyday consumers, besides being on the lookout for that certified compostable packaging and, the restaurants that you eat at and the entertainment venues that you go to, some other great tips that you can kind of bring in your home. Is getting away from plastic. And I like to start with one room in your house, right? It can be really overwhelming, but starting in the kitchen, where we have the food that we eat and where we spend a lot of our time. So getting rid of your plastic Tupperware, especially if it's got scratches in it. Those scratches release thousands of microplastics. So getting rid of the plastic Tupperware containers and switching over to glass, aluminum, stainless steel, other alternatives. I'm sure, like a lot of you, like me, hoard your old spaghetti jars and
Yeah.
salsa jars. Those work just fine. You do not have to make a huge investment to live a more non-toxic lifestyle. And then, whenever you are bringing food home to go that isn't in compostable containers, immediately switching it over to your glass or reusable containers, especially if it's in styrofoam. What a lot of people don't know is that the World Health Organization actually listed expanded polystyrene, or what a lot of us call it as styrofoam, as a known carcinogen. So getting that immediately out of foam containers, especially if it's hot food that you've brought home, and never reheating it in the foam containers. I also suggest switching from nonstick pans to stainless steel or cast iron pans. Those nonstick pans are coated in PFAS, which is another really dangerous chemical for our health and the health of the environment. And then switching to more non-toxic cleaning alternatives and cleaning supplies. So you can be on the lookout for certifications like Safer Choice whenever you're in the grocery store picking out your dish detergent or your, all-purpose sprays. You can also make all-purpose sprays and hand soaps and dish soaps from like Dr. Bronner's castile soap, or even, vinegar and citrus. So some kind of DIY options or store-bought options. The one thing I always like to point out, and especially in terms of women's health, is making sure that you're ditching fragrances. So read the labels, be on the lookout for that word fragrance, perfume, parfum, scent, aroma. Get rid of it as quick as you can. Yes. They're literally the secondhand smoke of our generation. It's like that bad for you, and it's so pervasive. It's in everything. But starting, like I said, one room at a time. So as you're already making that switch to more sustainable cleaning supplies in your kitchen, go ahead and opt for those fragrance-free, unscented versions, especially in trash bags. It's funny how scented trash bags are. And then some other things that I always like to point out when looking for these new products is using apps like the Environmental Working Group's Healthier Living app or the Skin Safe app. They're super easy apps. You can even scan barcodes or just type in the product or the brand and you get a rating on, different scales, but really easy ratings to read about the toxicity of the different ingredients and things like that. So those are kind of like my 5 tips to kind of start on a more sustainable journey in your home, especially, like I said, starting in a really easy place like the kitchen or in your bathroom.
That is awesome that because it is overwhelming to think, "Oh my gosh, look at everything around me," but just making tiny little adjustments like every day and picking, like I always say when I'm moving my house, you're moving out of your house, you don't just start packing everywhere. You start with one room and you move to the next. But
Exactly.
but I think, there's just so much information out there, and I really appreciate those tips. And what we'll do is we'll put the tips in the description of this podcast. So if you didn't jot them down, if you're listening on one of our Audible platforms, you'll be able to see that. So I'm curious, Blair, like, where did you learn all of this? Like, how did you get into this?
Yeah, definitely. So, I'm the circularity coordinator at Better Earth. As I mentioned, we're a sustainable packaging provider. In my role is to connect our compostable packaging customers with composters to close the loop and create, zero waste restaurants and zero waste schools and venues and events. And so, through my exposure to composting, I really started to see how the food system can really be the thing that saves us and saves our planet, and how, they're so connected. And then I came to compostable packaging, and that's where I really started to see the implications of the traditional plastic packaging industry. And at that same time, it was when my endometriosis was really at its height. And I was just frankly mad. Like, I was just mad. And I just went on a research rant. And, I had been, being in this industry, I'm a little bit more exposed to, a lot of these studies and articles and headlines, making the correlation between the rise in chemicals and the rise in health and environmental crises. But really, it took me getting to a place of like personal, passion to really dive deep into this and to get into the nitty gritty and just do hours of research. And to your point earlier, to figure out, why is this happening to my body? Like, where is this coming from? And then through that research, realized how it's affecting so many people in our society. 1 out of 10 women have endometriosis. That's someone in your family, that's someone in your friend group, someone in your classroom, or, someone in your company, or at least in your department. And so realizing how widespread this was, and realizing that I can combine my passion for sustainability with, my women's health advocacy, passion, and it really overlaps, and it really all comes back to that reducing our chemical exposure. And for me, in my role, that's through reducing plastic packaging in the food service industry.
Well, I'm so thankful for your curiosity and people like you digging into this. I mean, I was talking to a doctor of mine, a friend of mine, and they said, we received less than 45 minutes on endometriosis in medical
Yes.
school. And I fact checked it with, because I go to like a super specialist. Like, I mean, it's like there's, anyways, it's a whole nother story. But I go to a specialist center, kind of like Mayo Clinic or Cleveland Clinic, but for what I have. And I asked my doctor about it. I said, "Hey, I'm curious, how long did you learn about this in medical school? I heard it's like 45 minutes." She goes, maybe less, Nancy. I'm like,
Yeah.
that is scary. I mean, and I know that will change. I know that will change because people are starting to talk about it. And it's weird because when I got it, I I became more, I didn't talk about it. And so I wanted to hide it, and didn't, and you can't see it, so it wasn't as obvious. But I'm just thankful
Yeah.
that there's a lot more research, there's a lot more development. And and I asked my doctor, I told her, I said, well, I'm actually doing a podcast with my friend Blair, and she's in sustainable packaging and how this ties together. And she goes, 100%, like this
Yeah.
is like, I mean, and she's like,
I love to hear
I
that.
mean, she's like an Uber specialist. I mean, in this, and she was. I mean, she fact checked me. I mean, I wanted, make sure, speak to her, speak on the doctor's side, which Blair and I are hoping to talk more about this topic in the future. But more to
Well,
come
and
on
to
that.
your point, yeah, to your point, like, I'm so glad to hear that your doctor is making that correlation between the packaging, that we're putting our food in, and, these, increase in things, especially endometriosis, like in our cases that we're seeing. And, how can we translate that, to the consumers, right? Like, how can we get all the women out there. And then, like we talked about earlier, too, the women and the men, we're all experiencing this. Like, how can we just continue to spread this message and help more people know, about endometriosis, and how widespread it is, but then also how you can, work to start protecting yourself and at the same time, be protecting the planet too. But I'm so glad to hear that she, was like, yes, 100%. And looking forward to hearing more stories of people who are starting to make that connection. It's easy for us in the industry, like I said, who kind of like hear these things, but whenever you hear of, people in your community and things like that starting to really make that connection and starting to make the swap to more sustainable alternatives and lifestyle, you're like, yes, yes, okay, there's hope.
Yes, I mean, there is hope. And that is one of, I mean, to be honest, and I shared with Blair, I was actually going to start not an industry podcast, but my, my health like journey podcast. And so, but I ended up with thinking, I think I'm going to start with the food industry. And so I'm really excited that I get to share this part of myself and use this platform. And, if we could get this out to all the restaurants, out there and people, consumers demanding, this kind of packaging, then we're going to make a better earth,
Yeah,
pun intended, and, healthier lives. And again, like it's really, our health and the decisions we make about, the sustainability do go hand in hand. And I'm just really thankful, again, for all the education and how smart Blair is and all the research she's doing and, her curiosity. And, I think that's one thing that has been with me. It's like, I could have just given up like a long time ago and just been like, okay, this is what I have. No one can figure out.
yeah.
I'm just going to accept being at a level 7 to 8 of pain literally every single day of my life.
Yes, 10. Yeah, off the charts, off the charts. They don't
Yeah.
even have a chart for us.
Yeah. Just freaking knock me out. Okay. Just put me to sleep. Okay. And
Yes.
do it. I don't know what you need to do, but like, I mean, just knock me out. And that's, I mean, literally how bad it is. And so,
I
um,
think you brought up a really good point around restaurateurs and how through their purchasing decisions, whether it be packaging, their cleaning supplies, where they're sourcing their food, like they get to be advocates too, right? For women's health, for health in the communities, and for creating, this healthier future. So I love how you brought that up, how, that they get to like play an active role in supporting health in their communities just through their sourcing, more sustainable sourcing, solutions. And
yeah, I think, and that's cool. Like you can put that. I mean, a lot of people are putting it on their packaging and saying, "We do this. We
yes,
care about, our planet, or we care about women's health, or I mean, they should brag about it." And a lot of
yeah,
companies, I mean, I know Better Earth does. A lot of companies will give you signage and give you marketing tools to let people know, like, hey, I'm trying to make a difference here, not just, you're just doing it silently. Like, I mean, you should get the credibility, the credit
yeah.
for that,
Yes, if you're making that investment, like you want to showcase that impact, right? And you want to like scream it to the world and let them know, the benefits that, that you're passing on to them and how you care about them and the environment. How cool would it be to see in March, like an endometriosis awareness, like this compostable packaging is helping, helping women's health. That would be so cool. I would love
That
that.
would be amazing. I would be a loyal fan for life and
Right?
may not eat anywhere else. I
I
mean,
know. I would go back to that brand over and over and over again.
yeah. I mean, because it's kind of like, infertility, like, back when I went through infertility, like nobody knew about it. Nobody was talking about it. And so, like, back then, nobody knew. But now it's like, I feel the same way with endometriosis. I mean, it's like nobody, it's just coming more and more and more awareness coming out. And the more we all learn about it and take this seriously um, and everybody's health, these unborn fetuses. I mean, like
Yeah.
so anyways, it's just very exciting that there is more awareness and people like Blair out there. So,
Thank you.
well, Blair, is there anything other confession you want to share? Or, I mean, I know we've confessed a lot today. So,
I think, we've touched on it a little bit. We didn't dive too deep into our endometriosis journeys. That may be for another day. But like Nancy was just saying, reiterating that this affects 1 in 10 women and how debilitating this is and how it affects every aspect of our life and how I'm blessed to have an amazing husband and an amazing family and community of friends, female friends, female, practitioners. I built a really awesome female, medical team and have an awesome female boss who's really empathetic and understanding and flexible. And, just hoping to see more and more of that, in the world, in our workplaces, in our industry, to recognize endometriosis as a disease, just like other diseases that are as debilitating and affect your life as dramatically. So getting the word out there, and then we're already seeing a lot of exposure from different celebrities and media, opportunities. It was just on The Bachelor or The Bachelorette. I don't watch that show, but
my mom called me.
about the girl who's sharing her story. I know Halsey is really into advocating. So, getting the word out there, but then taking it a step further and, really beginning to think about how we can make, like I said, things more accessible and more flexible for people with chronic illness. So,
I love that you brought that up because I was sharing with Blair last year I had ankle surgery, and because why not? Because I love having surgery. And
what's one more, right? You've already hit your insurance. You've already hit your insurance. So you're just get it all done.
Yeah, so they hate me. But and that's a whole nother story. But
yeah, we laugh. Like, I also feel like we should point out we laugh, but it's because like we've gone through so much and like only we get this. So
yeah, it's super painful. I mean, like my blood can like start boiling talking about it. But it's funny because I had this surgery last year, and I actually was off my boot, but my doctor said, hey, listen, if you're going to I was going to the National Restaurant Associate, the NRA show. And they were like, you probably should wear your boot if you're going to walk as many steps as you're going to walk. Cause I was only like 4 weeks out of my surgery. And, everybody was like, oh my gosh, Nancy, do you need to sit down? Do you need to do this? And it was just so like people see that, like they're aware of it and they accommodate it for it, but like
they
nobody
can't see lesions on all of your organs.
No,
And
I don't like carry around my pictures. I mean, they're disgusting, by the way.
yeah,
They're really gross. But yeah, I mean, we don't share that. So, but yeah, I think thank you for bringing that up because I think in in this day and age, I think people are becoming more sensitive to sickness and like, don't come to work sick, but also like, this isn't just a girl, like, this isn't that time of the month. Like,
Yeah, that's what I was just about to say, is that it's so associated with, yeah, it's just, period pain. Yeah. And no, this goes so much farther beyond that.
yeah. So, but thank you so much for joining me, Blair, today. I'm just really excited to just continue the conversation about this, how we can help in the food industry, and as consumers as well. And then speaking more to how we can help people that are suffering with this disease. And I'm just thankful that there is a thing called Endometriosis Awareness Month. So,
Yes, yes.
okay.
Let's get the silent suffering out of silent and out to the masses, and
Yes.
conversations like the ones that you and I have been having, with more and more women and the broader public. So thank you for having me, and thank you for sharing your story with me, and your mentorship along my endometriosis journey.
No, I'm thankful for you sharing, because I know we were just talking about it like we don't share this with everybody. So, but it's out. Secret's out. So
No better time to start than Endometriosis Awareness Month.
yeah. So thank you so much. You're such a sweet friend and just kindred spirit. So thank you, Blair. And thank you so much for joining us on Confessions Beyond the Food today. If you like this, please subscribe and check out our other episodes. Have a great day, guys.
For more information, visit endometriosisassociation.org and look for these certifications when finding cleaner products for your home.